Good evening, everyone. I'm Amy Fairchild, and I'm Dean of the College of Public Health at The Ohio State University. I am beyond delighted to welcome you all tonight for the launch of Changing the Conversation, the Dean's Public Health Thought Leaders series. My goal with this series is to provide an opportunity for learning, for broadening our perspectives, for imagining new ways of approaching society's most vexing problems, and supporting our collective responsibility to act. I cannot think of a better guest to welcome to this inaugural event. I first met Dr. RaShall Brackney, Chief of Police in Charlottesville, Virginia, when she was the guest of the Moritz College of Law's Divided Community Project. She impressed me immediately. I was taken in by her thoughtfulness, depth of experience, and willingness to jump into conversations we must have about racism and American policing, conversations that are required to change policy and take us forward. Chief Brackney has said that we must uproot policing as we know it and regrow American law enforcement in partnership with the communities police are meant to serve. Chief Brackney's resume is much too long to recite here, and our time together is much too short to wait much longer to hear her speak. Among the highlights, she was the first Black woman to nationally oversee a special operations division. She's an expert in harm reduction, procedural and restorative justice practices, and community police relations, and was selected by the US Department of Justice to address bias-based and hate crimes reporting challenges. All of these things are core threads in the fabric of public health. And Chief Brackney has been thinking explicitly about the relationship between public health and public safety, which is at the core of our concerns as a college. How do we ensure that public health is always a perspective injected into these conversations? How do we ensure that public health, with our insights into racism and inequity, is always part of the conversation when we talk about how we allocate funds meant to serve the common good? We've already received dozens of excellent questions from our audience, and we welcome more. So if you would submit those through the Q&A session during our conversations, and we'll do our best to get to as many as we possibly can. Before we start, a couple of housekeeping notes. This session is being recorded, and it will be available next week on the college's website. All attendees, with the exception of our panelists, are muted, and live closed captioning is going to be provided throughout the webinar. Simply click on the CC button at the bottom of your screen to turn on this feature. And now it's my great pleasure to hand off the conversation to our guest moderator, Ann Fisher, the stalwart host of WOSU's All Sides with Ann Fisher, and Chief RaShall Brackney. Thank you both for being here tonight.
Thank you. Chief Brackney, did you want to kick it off with some thoughts in general about the topic that that has been called the bruising of America?
So thank you. Thank you for having me. The Ohio State University. I don't get to say that often, being a Carnegie Mellon alum. It's not even as cool a name. So yes, this is this topic, particularly to me, is extremely important. And the reason I titled it The Bruising of America, when Black, White, and Blue collide, is because of the confluence of when these three entities, policing in blue, Black communities, and the institutions of white supremacy in which policing have been built on, when they come together, the type of damage that they do to a community and have done to the United States only reaches the surface, right? We see that bruise at the top, and we fail to see all of the damage that is done beneath the surface and that we carry with us from that point forward. So to me, having those kinds of conversations of how we look at policing and police culture through a public health lens, and the ability to think about our culture much as a disease that you would use public health measures to eradicate, all seem to make perfect sense and sit in a different and unique place than I've ever thought about police culture in the 37 years that I've been in this profession. So from that lens, I think is important for us to have that conversation in a very different and nuanced way that we've not had these conversations about police culture and its influences in the way that we practice in the United States.
How are you having that conversation with the people that you lead in real life in a real police department in Charlottesville?
So what's unique about it, this is Charlottesville, where, you know, we came to national prominence in August of 2017 around racial disparities, inequities, hatred, and white supremacy. We all saw the marches that were occurring across the Charlottesville community and UVA's campus in August of 2017. So we're already starting out with a foundation of having very difficult conversations, particularly when we talk about the complicity of law enforcement during that time. There were lots of, there was a lot of anger and emotion. And then the reports, the after action reports came out, indicated that often, or that law enforcement allowed a lot of the violence to go on. And part of the conversations were they allowing these to go on because law enforcement was sympathetic to the neo-Nazis or white supremacists? And the outgrowth of that were chanting in marches that cops and Klan go hand in hand. So I start out every conversation when we're talking about police culture is if the community believes that cops and Klan go hand in hand, what do we do to really dig down to the root of that legacy? And how do we then change the narrative and landscape of that connection and that relationship? And those are very difficult conversations to have when people are looking at it through the lens that they don't believe they have biases or don't believe they have that in policing there are racialized agendas and policies, and that their profession was built on an institution of supremacy. And those are really challenging conversations to have, but you have to walk boldly in those conversations and you cannot back away from them, no matter how uncomfortable they may make you feel. And the last part of that is you have to own how we have contributed to our legacy, either through actions, our words, our deeds, our policies, our recruitment practices, our training practices, and often the denial of when we've been involved in these acts and the denial that we've not contributed.
You know, we've talked earlier about the makeup of most police departments in the country, the dearth of women, the dearth of minorities. And then when I was hearing your opening remarks, talking about them as not them, but the issue, the problem, the systemic, the system as a disease. And I guess it's sort of at the pinnacle of all of the, in terms of who you're talking to when you're talking to the folks in your department, of deniers of white privilege, they're sort of at that peak. And I wonder, I can't, it's hard enough to have a conversation like that almost in any event.
Yeah, and then you add on to it a phenomenon that we call blue socialization, right? The thin blue line.
Yeah.
When we're indoctrinating, whether we intentionally are doing this or not, all of our recruits with this mentality that we're under siege at all times. And you start to add on these additional layers, compounding factors that we use the word in medicine a lot. We have these compounding factors, right? There's these comorbidities that right. exist, right? We have that exact same thing in our profession. And the challenge around that is law enforcement today represents 18,000 different policing agencies throughout the United States. with more than 800,000 policing professionals. The majority, 80 to 85%, are white male in the profession, with about 12% being female in the profession, 3% being African American. So when you start to look at those persons who are affected, they are least likely to have access to the internal systems and workings of an institution that is being placed in their community to police that community. Not reflective of them in terms of variables and demographics, but also not reflective of the lived experiences of the community that they are policing.
And so what, I mean, and there's another phrase, the uproot and regrow, like people in the profession as it is may feel like you want to get rid of me.
And that's okay. Sometimes we need to be okay with saying you are not a right fit for the profession. I recently had a conversation with my grandmother-in-law who's from the South, and we were talking about gardening. I am a city girl at heart. Gardening is not my thing. However, we were having a conversation about what does a healthy garden look like. And sometimes when you find out that you have weeds in the garden, or when you're rotating the soils and you're not allowed to garden, or you rotate the crops, she said it's not enough to just put some surface killer, weed killer on top of a problem. That's the surface level. What do you do about that bulb and the roots that may go way into further along? Think of an oak tree. The roots have to be as deep and as long as the tree in order to support it. And that's what we need to do in policing. We have to get to the bottom of the root causes of supremacy and the systemic institutional racism, the roots that this profession has been built on. And if we don't get deep down in and start pulling that out, then we are going to be a lost society. We are the first entry point into the criminal legal system. And if we are not getting it right, it's going to be rotten from that point moving forward. And I liken this to not only gardening, but for those engineering or, scientists that are in the audience, think of it as a 4-lane highway. Well, I'm from the Midwest as well, being from Pittsburgh, so I know what it looks like to constantly have roads under construction, right? So there's always the cones and the 4 lanes go to 2, and you're traveling on 2 lanes. You're still using the highway, but the other 2 lanes, what are they doing? They're using this equipment to dig deep down to get to a solid, healthy foundation so they can relay the asphalt and then create something new that meets the needs and the demands of the travelers at the time that maybe the asphalt did not meet when it was put down in 1970. And we've had lots of winters and there are potholes all over the place. So we need to do the same thing with policing. Get to the root, build it, and start it all over as we reimagine not just policing, but justice in a very different way than the 1700 systems that policing was built on.
Right. Yeah. So when you're digging, just to continue the analogy, lots of times when they're digging up, they find things they're not expecting or proof of the way things were. And when you do that as an historian, it's quite chilling. There is kind of a parallel. A lot of times we like to look just to the South, but the North as well has similar constructions or similar scaffolding throughout history of the supremacy.
You're exactly right. And in the North, so what's interesting is we do pay a lot of attention to the Southern policing when it first started in under Black codes and slave patrols and what the purpose of those were. Interestingly enough, up north, they were just as interested in their factories and their businesses being protected. And the police were used initially to break up unions and striking personnel. So they've always been used as a very divisive arm of government, a very, when I think about it, just not one as a peacekeeping entity, but a maintaining of systems in which those persons, oftentimes who are disenfranchised, Black and brown communities, poor communities, were not given access to their government. They weren't given access to industry or business, and they were being shut out. And they were leveraging tax-paying dollars to have someone suppress them. And it's really interesting that we focus a lot on the South, and that's okay, but we need to also understand those Northern influences and how they've continued those legacies and are comfortable with their inheritances. As you can see that around unions and police benevolence associations, the desire to be protected and not allow access or transparency into their agencies.
When we're talking about it in these terms, it makes me think about how police also culturally, historically, they're not necessarily, if we want to talk about a class system, from the upper class. There's a supremacy there, but it's not that kind. They're being used by somebody else too, historically.
Right, absolutely. But if you think about it, when you operate in a culture long enough under those kind of demands, you somehow, slowly but surely, start to adopt that mindset. You're in that environment long enough. When you start to adopt that mindset, there needs to be a indoctrination. But the difference is, under the new models or considerations for policing and interactions, the populace has the power to demand the type of changes that money and access previously afforded just a small group of the community. So the key is, as I think about exactly what you're saying, of how you then, who's being leveraged to what means.
Yeah.
At some point, we have to stop buying into that as a profession and understand that we are an extension of government, and the laws in which we operate under, the legal authority that we've been given, those mandates have been given to us by those voters who put their legislators in, and not the opposite. Not the gentry class or the planner class that previously dictated how policing was done in the United States.
So I am a gardener, and I get what your grandmother-in-law is talking about completely. It's a great kind of analogy or metaphor. But so how does that then translate to a division of police in a city like Charlottesville or anywhere? What's the soil, and how do you get at it? Does it begin with language? Does it begin with, where does it even begin?
I wish it began at one spot, but it can't. So it starts, as I say, begin at the beginning all the time. We need to begin at the beginning. The first place that I see that I was able to make the most influence is in our hiring practices. And I'll give you an example of that today. Today we were reviewing applicants for hiring, and I said, this profession needs to be held as a profession in the highest levels of esteem. That means we only take the best candidates, the most qualified candidates. Why would we settle for anything less? And part of the pushback I received was, the desire to ensure someone was employed versus, was this the person who could give the best possible service to the citizens of Charlottesville that they absolutely deserved? And part of it is changing the cultural mindset of even those who are doing hiring and retention, Because if the default is that every white male who applies should get a job, that they deserve to have a job, and they're not looked at with the same type of scrutiny that other applicants are, and it may not be an explicit bias, it's those familiarity and implicit biases. So you started hiring, and then you must have somebody like me in the room who's looking at this through a lens of equity. So one, you create equity programs. You hire equity managers whose sole job it is to look at your policies, your practices, and your implementation. Language is extremely important. I am careful about the language that I use all the time. I have not called a single incident since the death of George Floyd a protest. I have not called it civil unrest. I have not called it and labeled it as a riot. This is individuals actually participating in their First Amendment rights to hold the government accountable. And they're doing that through rallies. They're doing that through marches. They're doing it through demonstrations. And when you start to reframe the language, even the officers have to rethink how they're going to engage. If you are told that you're going out there to monitor a riot or be involved in a riot or a protest, that's a different mindset right from the beginning. So that's a different tool. For you gardeners, that's the diggy thing versus the claw thing, right? You use the right tool. I talk a lot about language when there's adversarial. There was a course I was telling everyone was called Street Survival Spanish for Police Personnel. So when you're already setting up your training as adversarial, that if I don't know Spanish, I'm going to die at the end of this interaction. So we changed that and brought in our community of Sin Veradas who are teaching Spanish to our officers, right? We're bringing the community into our police station. So there's ways that we change the language. We don't have a use of force wheel. It's a response to resistance. When I talk about use of force, that then I have to think very differently about what is my response to someone resisting. That means I have to mentally engage what are the things that I'm seeing and responding to those versus just some rote behaviors in which I'm not challenging myself to think about it differently. And in Charlottesville, I have the advantage or possible disadvantage of being constantly under scrutiny because it's Charlottesville. Everyone knows daily and mentions Charlottesville daily. So I get to push some of my agendas and cultural changes. And the good thing with all the spotlight is there's less likely to have some pushback internally, at least not up front.
I want to go to a question from somebody in the audience because I think I want to riff on it if I may. They said some organizations and communities have called for defunding the police, and they asked what kind of funding model is appropriate. Well, hang on, hold that thought.
Well, definitely
sorry, I went to the wrong one. It had to do with about people want change. How can we support police and convey the message that we want to see change? Do we need changes in the law to make this happen? And what I'm thinking about when I think that is, people are very, I'm thinking about buy-in from the community. How much does that matter? And how people feel or don't feel comfortable with the idea of quote unquote, whatever we want to call defunding the police, or they're afraid to lose what they're familiar with too. And it's probably somebody who implicitly benefits from it. But be that as it may, how important is that buy-in, and how much should people worry about how things might change for them?
So I've always said those persons who are wealthier will always be able to afford protections, right? They may not have the government protections of a municipal policing agency, but they're going to live in a gated community, high levels of security. They're going to hire private security and things of that nature. I think that the conversation that I keep shifting it to is let's not focus on language as much as we're trying to focus on the problem we're attempting to solve and what solutions can we use to get us to that desired outcome. And what are those metrics that we can also use to see if we're meeting or benchmarking the way that we would want. The first thing I go into the communities and talk about is understanding what does a healthy relationship between the police department and your community look like, because we get our moral and formal authority from the communities as to how we police in those communities. So when you start asking different questions, I'm not asking, what does crime reduction look like to you, right? What does harm look like? What does safety feel like to you? And then when you start getting to those kind of questions, you then can renegotiate, as I say a lot, this social contract with how you police in the community. We've had formal contracts, of how policing is to occur, and that occurs through your contracts, your departmental contracts, or even union contracts, or even the legislator. But we never ask the community how they want to be and need to be policed. So there are things that affect communities differently. An example of that, there are these quality of life calls where you can imagine your neighbor has loud music all the time. That may force you to move, whereas you may expect that there might be an occasional burglary or a theft from your auto vehicle, right? We haven't come to a clear understanding of what we want in the United States as a policing model, because we've never been able to create the model for ourselves. It was handed to us, built off of institutional legacies of, slavery and breaking up union and strikers and things of that nature. So we've never had this healthy model that other countries have had, where the concept is that the police do what the community should be doing informally, only they're paid to do those things, right? The community should be policing itself. And there should be these norms of not, stealing your neighbor's car, or, killing someone. The police are formally doing that. And those principles started in England and London, but we now have a formalized system in which we're constantly having to renegotiate that. And with 18,000 different policing agencies, that is going to be a tremendous task. So it's going to have to become much more localized and tailored until we can think of a different way to move this across the nation as national models.
All right, so let me get to the question. I started off with it from someone in the audience. It's some organizations and communities have called for defunding the police. They ask, what kind of funding model is appropriate for a community-oriented police force? What's the right balance of funding when it comes to public health and public safety? So we do tend to get to this funding question, not a surprise, because it's the biggest box that we check on our most city budgets these days.
Yeah, and it's the most tangible, right? It's the first thing you see. It's a tangible, and you're thinking, okay, can I have a win? That's what people want. They just want at least to know that we're addressing the problem in some way. So I tell people all the time is this: disconnect from the funding model. Let's see what it is. Let's reimagine what justice looks like in our communities, and then fund to the justice models versus leaving it in one camp or another. You're never going to, and I'm sure this is a controversial statement, but you're never going to get to a point where there will be no policing in this community. That is not going to happen, no matter what we would all want that to look like. But is there a possibility that there's justice in that policing, those policing models? So we say all the time, I tell my friends, I tell my family, my daughter, I can tell what you value by two things: where you put your money. So I'm looking at your checkbook, and I'm looking at how she swipes her card. She probably doesn't even have a checkbook anymore, but her point of sales. Right. So where her money goes and what's on her calendar, where she spends her time, that tells me what she values. That also tells me what the United States and other communities value, where we put our money, right? We've taken our money from public health. We've taken our money out of the schools. We've taken our monies away from sheltering and affordable housing, education. We shoved all of our money elsewhere. Why? Because it was expedient and convenient to use one pot of money, 911, to address every one of those ills. And then there was no one who you could hold accountable for failing to address those. So I say, don't look at the dollars first, create the just model, and then reallocate, I say refund, redistribute the monies to where the responsibilities are as well. But if you're going to defund, as I say, you better have a system, as we're ripping up, lanes 1 and 2 for 3 and 4. So people say immediately that we want social workers to respond or behavioral therapists to respond to mental health calls, or those persons who are experiencing mental health crises. You better have the system in place. And it's not the time to test it or pilot it just because there's some legislature or some knee-jerk responses and we're not willing to fully support what that means. Because once the social worker is there and they're in custody and they know they need treatment, where are we taking them? There are no beds available. There are no mental health beds available. The number one provider of mental health right now are our criminal penal systems.
Right. In Columbus, voters decided on November 3rd to amend the city charter to establish a civilian review board. And of course, the details are forthwith, that was just the decision to change the city charter. In Charlottesville, the city council created a civilian review board, an oversight body for the police department, and the challenges. And I wanted you to talk about what that means in Charlotte, because we know there's a big difference when you change a city charter and when politicians make a policy change, for starters. But the challenges is just building a working relationship like that, and what you're hoping it'll look like. What's it like there?
It's made national headlines as challenging it as it has been for here, and particularly since the Virginia legislature just had a special session in which they have an enabling legislature that allows for the creation of civilian review boards with civilian oversights throughout the Commonwealth of Virginia. What's so interesting is there were only 3 civilian review boards in Virginia: Fairfax, Virginia Beach, and Charlottesville, which will probably be one of the smallest departments in the nation to ever have a civilian review board oversight. The challenges that exist is because when I've talked to them is, what are we attempting to gain by oversight? And have oversight models worked to get the desired outcomes, much like body-worn cameras? Have they worked to get the desired outcomes in reducing police violence? Have they worked in reducing police corruption? Have they worked? So the challenges in Charlottesville is, because everything I know or understand it to be is the outgrowth of the desire came as a result of the events of August of 2017 and the Unite the Right rally. So I talk about, is this the mechanism to get the desired outcomes? And what were those desired outcomes you were attempting to get by having this mechanism in place? Because it had, much like you said, an ordinance that is enacting it, and now it's being coupled with some legislature and statutes. What might that look like to this day? I have always said I welcome oversight. I am comfortable with oversight. I am building probably one of the most transparent departments without any oversight to this day. But what I will always say, any oversight of any body of government, industry, private or public, has to be fair, well-trained, equitable oversight. It cannot be, if we're looking for review, it can't be looking for retribution. If we're looking for review, is it part of a model to rectify prior or past wrongs, or to establish systems very differently? So the challenges for me have been working around or working with groups who, one, don't have the type of training that they would need, And as I've also said is, I'm concerned when we enact legislature as a response and it's not thought completely and totally out about the impact that it could or should have in a community. So here, Virginia legislature in their special session have said that the Civilian Review Board, as part of their enabling legislation, could have the power to terminate officers, discipline and terminate up to the chief with the exclusion of the chief. And, you know, I'm thinking, who else has those other powers? If I worked in an accounting firm and you have no training, how do I perform an audit and say whether the accounting practices are best if there's no one who has any real expertise? And in most of these boards, you may have a law enforcement person who's participating. They're non-voting, non-binding, and can only act in an advisory capacity. And the assumptions are that the police officers are automatically biased, which is interesting that we're assuming biases and that there can't be this neutrality here. And then the studies now are looking more and more towards, do our oversight bodies accomplishing the desired outcomes? I think there's still room for that. Part of the relationship challenges is neither agencies often start out with trust, right? If you have a civilian oversight, it's because they don't trust the police department that they're
going to ask you about
now
that.
having oversight over. And then you have the departments who are saying, wait a minute, we don't trust you as well. And one of the challenges that I even face particularly here, which is interesting, is I had a Civilian Review Board member, previous one, make an allegation that I physically assaulted her. That made national headlines. That doesn't build for a trusting relationship when you then recant that and say it was word choices. The chief asked me to leave a scene, you know, where they were interfering. But it's that kind of language that, how do you have trust when a Civilian Review Board member comes right out and it tells a falsehood? So that builds that kind of tension there. However, I am still willing to work with an agency, any review side agency, because our agency and every police agency has a responsibility to move towards excellence and reestablishing legitimacy and transparency in the communities that give them, like I said, their moral and formal authority.
That's the second time you've used the word transparency, and I wanted to talk to you about that and why that's important.
So the reason it's because, again, it's allowing access into policing where we've created this us versus them mentality. We create these thin blue lines, walls of silence, where we, you know, never cross these lines, or so seldom cross these lines, right? So the community doubts us. They doubt that we are there to serve, and our actions don't always align with our words and our mottos. As we know from the death of George Floyd and about 50 others that any one of us in this webinar could rattle off without hesitation, frighteningly so without hesitation. So for me, the transparency and legitimacy are absolutely important. And I see our guest host has just popped in there.
Dean Fairchild, you have a question from the audience to convey.
This
is like a game show.
I can only sit back so long. So one of the things I've been doing in the background is looking at some of the questions, and there are a couple that hit on a common theme. You've talked about history, you've talked about structure, but one of the things that I'm thinking of tonight as you speak is this line from the feminist movement: the personal is the political. Yes, we have to walk boldly. We can't back away, no matter how uncomfortable it gets. And at the same time, you're an individual walking into these policy conversations, representing a whole lot of people, representing a perspective, and you have your history. But those are moments of real emotion and discomfort when we're in these positions. So one of the questions was, what are the vicissitudes of pressure that you face? What are the kinds of pressures, internal, external, and how do you negotiate this relationship? Emerging a lot of questions here. How do you negotiate this relationship with other police chiefs? So it's how do you feel this pressure? How do you negotiate? And how do you, as an individual, expand your influence as part of these conversations?
So, you know what, it is an interesting balance. I've often been asked that, and I say every day I balance my race with my profession and my gender. I am multi-ethnic, for those persons who may not know, but I identify as Black. Probably not for the reasons, that the Black codes and Jim Crow or all the other things that talked about Black folks, but I always have to say, if you've been raised by a Black mom, there is not going to be a whole lot of other stuff that you are going to be, but in her house, but that, right? And that was my culture and everything. So I've always had to balance that, right? And then when I entered into policing, that became an issue, as well as gender, in this very male-dominated profession. And then add to that it's a white male dominated profession that brings with it, and I hope I don't offend folks, a lot of testosterone, right? There's guns, and there's motorcycles, and there's bombs, and there's, AR-15s and helicopters and rappelling, and you name it, that typically are associated with, male professions or male dominated professions, and it's paramilitary on top of all of these things. So there's this constant having to prove yourself worthy. So I'm careful about a couple of things. So when I'm in the profession and I'm giving a lecture, and the audience is predominantly police, law enforcement, or policing, I use chief. When I'm in academia, you will often hear me use Dr. Brackney instead, because I understand the audience in which I am speaking to, and my credibility changes based on where I'm sitting in that. Internal pressures, there are a lot. As we all know, as we break through glass ceilings, I say this a lot. When you break through a glass ceiling, remember the shards that occur, the deep cuts for that person who is breaking into that, only to land on a floor, right? So once you break the floor that is already cracked and crumbling, and something is already happening there, in which you often are bringing in women and minorities to address. So that floor is not only crumbly, but it often is a cliff in which you're going to push somebody right off of, because someone has to be the sacrificial lamb when things don't go well and you don't fix it quickly. The same person you brought in to address the issue is the person that you then, quickly discard. Internally, those conversations are extremely challenging. And I'll give you an example of that. Is I just had the Anti-Defamation League come into our agency and spent a week here on classes tailored for Charlottesville on managing implicit bias, identifying it, understanding it. And it was disappointing, but not unexpected, the feedback that I received from some of our officers, even to the point that the facilitators from the Anti-Defamation League, right? They are the gold standard in understanding hate and implicit bias. They called me and said, can we have a debriefing with you? Because they were so surprised by some of the responses of just, not seeing how we in law enforcement are contributing every day to the narratives, right? It's not a one-off like George Floyd. George Floyd is what we see on television for an agonizing 8 minutes and 46 seconds. It's the everyday that we continue to do damage out in the communities through the profession. And some of the comments would shock you that I read every single day. The emails that I receive from anonymous that call me an affirmative action quota hire turned desk jockey. The emails where, you know, I'm called a white nigger. The emails where my race, ethnicity, and ideas are challenged on a daily basis as to what does a just and humane profession look like in policing, so that we can get back to justice in the criminal justice system, because we've never been there. So there is a lot of balancing going on, Dean, as we wear all of these hats. And how does that translate to trying to change the culture? If you can change it here in Charlottesville, imagine that, where people were walking just 3 years ago with tiki torches, warmed by the glow of their tiki torches, wrapped in Confederate flags, and feeling the comfort and the warmth of that. And we're boldly doing that here, where an administration hung on to those words and still fails to denounce that kind of hatred here. If we could change it here, imagine how we could move that out concentrically throughout the nation. And to your public health personnel and those persons who are really interested in that, think about how we could really go about starting to try and heal a nation that has been built on a system of inequity from the beginning, and using policing as one of the tools to maintain that supremacy.
I'm wondering about the other side of the equation, and that's the community that divisions of police serve, and the trauma that's occurred in many communities for centuries now, and how that changes. It's one thing to say, all right, I'm way oversimplifying, just to say, I'm changing because I have to if I want to keep my job. It's another thing, how do you change what's been, how they've been indoctrinated?
So the first thing is, I jokingly say, well, I appreciate that people are now semi-woke, and I now have my colleagues, you know, walking and taking knees and, you know, supporting, or we'll put like Black Lives Matter mask on, or we'll hold a sign that says I'm an ally. How do you change the culture? One, you hold those at the top of it, you hold them accountable. The first thing I've said more than at this point now, started having these conversations about 10 years ago, of owning how we've contributed to the trauma in the communities and our failures to do that. A chief in LaGrange, Georgia, Lou Ditmar, once talked about how policing in LaGrange, that the police department actually assisted in the lynching of individuals. And he came out and said, you know, we have to own that's part of our history, and we need to apologize, and then we need to make retribution. We need to, I'm sorry, not retribution. We need to really reparations to this community. And reparations go beyond what people think are monetary. If you try and repair something that has never been healthy to start with, you're just going to get another broken project. It is now, how do we rectify the harm that we've done and the trauma that we've inflicted in communities? And part of it is I get screamed at a lot, yelling it, but I know where the pain and the rage come from. So I've got to allow people to feel that in the way that they need to feel that, and then say, what is it that I can do from this point to do no harm in this community, to not hurt this community, understanding that there is the need for safety and people feeling healthy and want to be able to not just survive our communities, but thrive in these communities. And we can't be a barrier or an obstacle to that.
And if I could, I'm I'm seeing a lot of support for you in our questions are on the part, and I'm thinking about our students in particular who are feeling vulnerable and unsafe during this period of time. And so one of them asks, she says, I really appreciate your boldness as a Black woman doing this work in policing. I'm in awe of how you share so freely your identities. Thank you for your vulnerability. I'm wondering if you can talk about how do you take care of yourself in the midst of doing this work? How do you take care of yourself in the midst of Breonna Taylor, George Floyd, and so many others? I think our students are expressing support for you. They're championing you, but wanting, I think, to learn from you too. How do they, how you sustain yourself? How can they sustain themselves? How can we help sustain our students?
So how do you do that? The first thing, you have to be kind to each other. I mean, we have forgotten about the human part in the humanities. We have forgotten about just how amazing we are as human beings. And every day when I come in here to work, I know we aren't supposed to talk politically or faith. I am a faithful woman. I have an amazing husband who's a professor. I have a daughter who I connect with every day. And how do you stay the course? Because you can't, there isn't any one of us who can afford to give up right now. Like, we are on the cusp of greatness and holding this nation accountable for one of its most original sins, and how we treated each other. So that's the first thing I do. I don't run as often as I used to, just because I don't have the time, but I affirm and spend time with people who are kind and like-minded as well. Every day I recite as I come in here, there's a scripture, it's Psalm 78:72, and it says, and David shepherded them with integrity of heart. And with skillful hands, he led them. So maintaining that integrity of heart refreshes me every single day that we are trying to do the right thing. And if not any of us, if not your students, who? We've seen what it's been like with previous generations who've been okay and are still okay and are complicit in this continuing cycle of harm. And from a public health perspective, supporting each other, wraparounds, and being intentional about relationships. I am intentional about my time. Not as good as I would like to be to my poor executive assistants, but being intentional about my time. And then you get these things from an amazing dean that surprises you. And you open it up and says, hey, take care of yourself and have some snacks while we talk to your team.
Best caramel corn ever.
It's those random acts of kindness and support. It's emails or chats when someone says, hey, we see you. We see you. And when I see you, I then can help sustain you. So those are some of the things that I think about. But if there's anybody out there who wants to do virtual runs or something with me, please give me an idea of how to get back to that.
I'm told I have time for one more quick question. And
we have time. We're at the end. Yes.
Yeah. And it's flown by as I knew it would. But I just wonder what, what's next for you? I don't know. I mean, you've, got degrees, I don't know. I mean, the status and everything, what do you do with that? Are you thinking about something else?
I have been very fortunate to be in this profession for 37 years. I've had experiences that I would have never thought. I grew up very poor, inner city, one of 6 kids. I've got 4 sisters and a brother. We ignore our brother all the time. Sorry for those of you who have brothers and things like that. So what's next for me is where I'm led to next. I am on a mission to reform police culture, not policies, not procedures, because we all have policies and procedures. It's how we implement them that really is where the power lies. I have been on this terror to do that for literally now 25, almost 30 years, about how do we change police culture. So, you know, what's next for me is when COVID's over, maybe visit a winery. Supposed to get back up to Ohio State and spend a little time there. I'm not a meat eater, but I just heard about this barbecue place on Diners, Drive-Ins, and Dives that is like everybody goes to. So you know, what's next? Just being as intentional with the time that I have so that I can have the most impact. And if Charlottesville allows me that platform, I'll keep doing it.
Well, I just wanted to let the audience know that you said that you would like to see all of the questions that we weren't able to get to, and there are many. So, and then also say thank you so much, Chief Brackney, for your time today. Tonight, I really appreciate it. It's been a joy. Thank you.
You are absolutely amazing.
Before we sign off, let me also express my thanks. What I heard tonight was that history matters, structure matters, language matters, grace matters, and as a historian, it's clear, and I appreciate the history you injected into this conversation so consistently. We don't have a shared narrative about how we got to this point in the United States. It's one of the sources of our division, but we're not going to be able to reckon with the future unless we can also grapple with the past. So I thank you for the richness of what you offered us here tonight. And I thank you for somebody who's intentional with your time, that you cared enough to come and spend some of your time in public health. Speaks to the breadth of your vision. And I thank you. And I thank everybody who joined us for being intentional with your time tonight and being part of this conversation. Thank you so much.
Thank you. Be well.